Does drinking alcohol increase the risk of getting cancer? Get ready to get all your doubts cleared in this video. In past few weeks and months, there have been multiple news reports about scientists saying that the alcohol drinking is linked to increased risk of getting cancer. So, is it true? Does drinking alcohol really cause cancer? Answer to this question is, yes. Drinking alcohol has shown to have direct link to development of cancer. There are multiple types of cancers which can be caused by alcohol, which are breast cancer, liver cancer, esophageal cancer, oral cancer, laryngeal cancer and colorectal cancer. Risk of development of cancer is linked to amount of alcohol which a person has. Risk is different in light drinkers, moderate drinkers and heavy drinkers. In this table you can see that the risk of cancer is shown as 1, which means that non-drinkers have comparatively no risk of development of cancer. For example, risk of esophageal cancer is 1.26 in light drinkers. This means that light drinkers have 1.26 times or 26% higher chances of development of cancer compared to non-drinkers. Risk increases as light drinker becomes moderate and heavy drinker. So, in heavy drinkers, risk of getting oral cavity, pharynx and esophageal cancer is about 5 times higher and risk of getting larynx and liver cancer is approximately double. Similarly, increased risk in getting female breast cancer and colorectal cancer. And how do the scientists know the link between alcohol and cancer? The relationship between drinking alcohol and cancer risk has been evaluated extensively in epidemiologic case control studies, cohort studies, systematic review and meta-analysis. The systematic review and meta-analysis are on top of the pyramid of research quality and are the most trustable types of research which people should believe. So, why is having knowledge of link between alcohol and cancer is so important? It is because, in 2012, 5.5% of all new cancer occurrences and 5.8% of all cancer deaths worldwide were estimated to be attributable to alcohol. In the United States, it has been estimated that 3.5% of all cancer deaths are attributable to drinking alcohol. Centers for Disease Control and Prevention data has shown that approximately 88,000 deaths were attributed to excessive alcohol use in the United States between 2006 and 2010. Approximately 3.3 million deaths worldwide result from the harmful use of alcohol each year. Also, population surveys have shown that 12 to 14% of adults currently have alcohol use disorder, and 29% has such disorder at some point in their lifetime. Does cessation of alcohol consumption lead to lower cancer risk? Answer is yes. The results of meta-analysis and pooled analysis that have focused directly on this question for upper air digestive tract cancers indicate that risk of these cancers declines in those who quit drinking alcohol compared with those who remain alcohol drinkers. The evidence from these studies suggests that the risk of cancer after long-term, greater than 20 years, cessation from alcohol drinking may be reduced to that seen in people who never drink. Alcohol, also known as ethanol, gets converted to acetaldehyde in liver, which in turn gets converted to acetate. Alcohol, also known as ethanol, per se does not cause cancer, but acetaldehyde is carcinogenic and mutagenic, which acts by binding to DNA and protein mechanisms that included oxidative stress, sex hormones, folate metabolism, and DNA methylation, as well as cirrhosis for hepatocellular carcinoma. Alcohol affects circulating concentrations of androgens and estrogen, which is a pathway of particular relevance to breast cancer, and it lowers folate concentrations, a relationship that has been extensively studied in relation to the causation of colon cancer. The International Agency for Research on Cancer has classified alcohol as a Group 1 carcinogen, because they found that it causes cancer in humans. Some other risk factors which are found to enhance the carcinogenic capabilities of alcohol. Individuals with cirrhosis and chronic liver disease are at much higher risk of liver cancer, and the main preventable causes of these conditions are chronic infection with hepatitis B and C, chronic alcohol abuse, and non-alcoholic fatty liver disease. Drinking guidelines by the American Heart Association, American Cancer Society, and U.S. Department of Health and Human Services recommends that men drink no more than 1 to 2 drinks per day, and that women drink no more than 1 drink per day. In addition, it is recommended that drinking alcohol should only be done by adults of legal age. People who do not currently drink alcohol should not start for any reason. The National Institute of Alcohol Abuse and Alcoholism defines a standard drink as one that contains roughly 14 grams of pure alcohol, which is the equivalent of 1.5 ounces of distilled spirits, approximately 40% alcohol by volume, 5 ounces of wine, approximately 12% alcohol by volume, or 12 ounces of regular beer, approximately 5% alcohol by volume. The evidence shows that drinkers are often unaware of how standard drinks are defined, and that these standard drink sizes are commonly exceeded. There are also people with wrong knowledge about benefits of drinking alcohol. Light alcohol use among cancer survivors has been perceived as potentially beneficial for treatment-related adverse effects, although there is little evidence to support this concept. Some reports have shown that drinking alcohol is good for heart, but there is no reliable research which has shown this effect, and alcohol consumption is not recommended to prevent cardiovascular disease or to reduce all-cause mortality. To live a healthy life, there are some simple rules to remember about drinking alcohol. Rule number 1 is that, the more that a person drinks, and for a longer period of time, the greater their risk of development of cancer, especially head and neck cancers. Rule number 2. Associations with cancer are specific to alcohol per se, and not related to the type of alcoholic beverage. The answer is that, the associations between alcohol drinking and cancer risk have been observed consistently, regardless of the specific type of alcoholic beverage. So it does not matter whether you are having a beer or gin or vodka which has high alcohol concentration, all of them will cause cancer. Rule number 3, and the most important rule of all. World Cancer Research Fund and AICR recommend that, for cancer prevention, it's best not to drink alcohol. So, if you do not want to increase your chances of getting cancer, just do not start drinking if you are already a non-drinker, and if you drink, then stop drinking right now. Thank you for watching this video. You can like, subscribe and share this channel to be up to date with more health-related videos.